All right. Our last speaker of the morning for you guys. Should be a great talk on nutrition. So, up next, I have Lindsay Orbeta. Lindsay is a registered dietitian with a double master of science in both sports nutrition and exercise physiology. She works closely with us at UCSF in the sports medicine department and women's sports medicine center, as well as for the Oakland men's pro soccer team, the Oakland Roots. She's a sports registered dietitian for the UCSF Human Performance Center's Run Safe program, counseling more than 150 runners annually. She has also served as career senior nutritionist for Alameda County, overseeing compliance of California state-funded senior meal programs. Lindsay has plenty of personal experience to bring to bear on the topic of sports nutrition as a collegiate swimmer and former Ironman 140.6 triathlete. That's a lot, in case you don't know what that is. She has also published peer-reviewed article on nutritional strategies for endurance cyclists in Current Sports Medicine Reports. We're so grateful to have Lindsay for joining us today. And her fun fact of the day is that she's had pretty much every injury you guys are going to learn about this weekend. But it makes her great when she's working with orthopedic athletes. So please join me in welcoming Lindsay Orbeta.
Okay. Hello. Thank you for that introduction. So today I'm discussing diets that heal, and specifically these are antioxidant, anti-inflammatory, and analgesic, which means pain relieving. There'll be a couple little words that I repeat a few times, but this is one of them, analgesic. So yeah, these are the foods that I hope you can incorporate into your own lives. And I have no disclosures. So exercise-induced muscle damage, that's EIMD. So this is, I'm going to move this over a little as I walk. It's characterized by an initial insult to muscle, and that is usually going to be from mechanical stress. And if you're an athletic trainer or PT in the audience, you know all your patients probably have this. And so really, it's most commonly occurring after we have eccentric forms of exercise, which is where the contracting muscle is forcibly lengthened, or it's due to unaccustomed exercise. Like it's something brand new and it's novel to us and our body's like, no. And we usually feel it about 2 days later. Like, what did I do wrong 2 days ago? And so if you think about like running downstairs, that's like the kind of stuff I'm talking about. Eccentric movements, very common. And so this is followed by an acute inflammatory response within 4 hours of the injury to muscle. And then there's like a whole fun secondary wave of inflammation that occurs later. So these are the things that happen in that second wave. The first is that dreaded DOMS, delayed onset muscle soreness, and all of the like impairments of strength, muscle power, explosive force, and range of motion that come along with that. And those four things kind of co-conspire to really impair the next day's performance and how we feel fatigue-wise and how much we can lift or move the next day, or sometimes 2 days later. And then the second thing that happens is a loss of cell membrane integrity in every single muscle cell. So when that starts to kind of get soft, all of these intracellular proteins leak out of the cell into the blood. And one of these is called creatine kinase. And the reason everyone knows that one so well is because it peaks in plasma between 24 and 72 hours after whatever you did wrong to yourself. And it depends completely upon the mechanism of exercise, the duration, and the intensity when that would show up for somebody. So aside from creatine kinase, we have a bunch of fun cascade, if you will, of pro-inflammatory cytokines. And these are also measured in the blood, and that's why I'm bringing them up now. I don't want to just throw a bunch of like random labs at you, but in the studies we look at, these are the things that we're looking for that are biomarkers of muscle damage. And again, that's more of a physiological measurement, and who cares at the end of the day? Like anyone really cares about is like, I'm in less pain than I used to be. And that's subjective measurement. So all the randomized control trials that I present to you today looked at both, and that's what makes them like really rigorous studies. So again, back to those physiological measurements that show up in the blood. The first of these is called tumor necrosis factor alpha, TNFA. That's a biggie. And the other is interleukin-6. So they're inflammatory cytokines, And the last one, some of you may have seen some of your patients get measured. You may have had it. It's CRP, C-reactive protein. It's a very nonspecific inflammatory marker. So those are things we look at. And then finally, just exercising intensely, like the more load that you have and the longer the duration, we're always going to be generating a normal metabolic byproduct called RONS, reactive oxygen and nitrogen species. This is really just a result of the nitric oxide that we get in the body from muscle contraction, from vasodilation. And it's when this starts to like really hang around too long that it causes a lot of cellular damage. Okay, so that's what we look at for exercise-induced muscle damage. Okay. Trying to get the button to work. There we go. So specific foods are known to reduce or invoke inflammation. And the ones that I'm going to be covering today are cocoa, different fruits, turmeric or curcumin, fish oil, and then I'm going to wrap up by telling you about some pro-inflammatory foods and where they come from that we would want to be avoiding. So in terms of looking at nutrition for pain management, we almost don't look at it. We overlook it entirely, right? And I'm sure that many of your patients, they're taking NSAIDs for this kind of stuff. But NSAIDs have their own problems. So if we're using them long-term, they can cause GI issues, which is really a problem for athletes. And then they can cause like stomach pain, stomach bleeding, and long-term it can cause kidney injury. So it seems like we should be looking to diet as medicine and not just be reliant on drugs, right? And then of course there's a whole other non-drug use of therapeutic agents like cold water immersion and ACE bandages, rice, things like this. But the problem is not all aspects of recovery are enhanced by those methods. So we want to look at something that's like a good catch-all and that can solve all the problems of muscle damage. All right, so let's take a look at some of these foods. I think I just turned off the computer. I don't know how I did that. Oops. Sorry, guys. I don't know what I'm doing wrong. I'm trying to go back with the back button, but it turns it off. Where's the AV people? Hi. No, it's not a video. Oh, that's what it was. The video doesn't want to work. Let me tell you about what this video is going to be, okay? I was going to tell you about this really great meme. Yeah, sorry. It's a race car, and the race car is coming like really dangerously close to the wall. And the race car is supposed to represent us, if you're over 40 especially. And then the wall, which it's just that narrow margin that it's missing, is injury. And that's like when you're over 40 trying to hit a PR in the gym. It's just like that real narrow, razor-thin margin between strength gain and an injury. And I don't know if anyone of you are over 40 in this room and you felt this way, but this is literally like my life and all the injuries that I've had. So I chose this topic to, let me go back, to talk about these foods and learn about them because I, 6 months ago, incurred a complete proximal hamstring tear. So that's all tendons ripped off the pelvic bone. And then I found out that a few months preceding that, I had ripped 2 out of 3 tendons on the right. So I'm living with both of these like really traumatic injuries that usually require surgery. And I decided to go non-op. And I have a tremendous amount of functionality. And I think a huge part of that is diet. Truly. So I'm not just like a standing billboard for this, but it's to really show you that if you add a lot of these high antioxidant foods chronically to your diet and they become a pattern, that's where you're going to see the greatest benefit. So some of these studies look at acute dosing, like, oh, a day before, what happens if you eat a load of blueberries? But really, my message to you all that I hope to impart is that changing your diet long-term, like patterns, that's really going to incorporate these things into the tissue where it can really have a therapeutic effect. So anyway, that's why I chose this topic. Sorry you can't see the awesome meme. So let's start with cocoa. So the bioactive compounds in cocoa include polyphenols, flavonoids, PEA or phenylethylamines, caffeine, and quercetin, and they're in different amounts. So we're going to look at each one a little. So polyphenols actually make up 10% of cocoa by total chocolate weight. And one good quality dark chocolate bar can have more polyphenols than an entire 2 days worth of fruits and vegetables and more than a glass of wine. So I know a chocolate bar is a lot to eat, but it's still showing you that there's a lot of good stuff there. And so flavonoids comprise about 15% of cocoa by weight, and they're another type of polyphenol that's really vital in understanding how cocoa can influence pain. So the relationship between pain and inflammation is complex, but when you look at the immune responses, they're very common underneath them all. So flavonoids is really one of the best ways that can point to how cocoa can help relieve pain. Do you remember earlier I talked about those reactive oxygen and nitrogen species? This is one thing that it really tamps down on, and that's called RONS. So the second aspect of all cocoa is that it has small amounts of caffeine. And caffeine is only 0.2% in raw cocoa, so very tiny, tiny amount. But when it's made into chocolate, depending upon the type of chocolate, it has different amounts of caffeine. And we'll look at one of those studies. So 3 squares of 70% dark chocolate has about 25 milligrams of caffeine. And as soon as we get a 15 milligram dose or above, that's when we start to see these analgesic effects of caffeine. So another way that caffeine is used in sport, I'm sure you have all seen, is a potential performance enhancer, right? So it kind of has a lot of things there, but caffeine is just one aspect in chocolate. And then the way that caffeine actually is a pain reliever is that it can block adenosine. Adenosine is that wakefulness and sleepiness chemical that builds up over the day. Caffeine is a perfect fit for the receptor of adenosine, so it blocks that. It makes us more alert, and it relieves pain. And the reason I tell you about this is it's the same mechanism for how NSAIDs work. They're adenosine blockers. So caffeine, that's why it can be outstanding and why some of you guys are still drinking at 11:30 a.m. So a primary compound, too, that's also found in cocoa is PEA, and this is phenylethylamine. It's actually similar to speed and heroin in that it creates feelings of ecstasy and euphoria, and that's because it releases dopamine. But there's such a small amount of PEA that we'd have to consume over 30 pounds of chocolate to get those ecstatic, euphoric feelings. So, but it is in there. And then finally, quercetin. Quercetin, you may have heard, it's like a supplement that some people take. And it's the most abundant flavonoid found in our diet, in fruits and veggies. And it's been shown to increase the pain threshold because it promotes the release of serotonin, which is, of course, the happy chemical. And then, of course, sugar. Sugar is going to be in chocolate, not in cocoa, but in chocolate, and it's in different amounts. And sugar has that endorphin effect, and it attaches to opiate receptors in the brain, and that's how it blocks pain. Okay, so that's kind of a no-brainer about sugar. So let's take a look at the first study, and this is a double-blind randomized control trial. And they looked at 3 different kinds of chocolate: white, milk, and dark. And you can see the different percentages there, like 30, 34, 70%. And so they were looking at the effect of these 3 kinds on pain duration, peak intensity, and pain threshold. So what they actually did is they put a hypertonic saline injection into the jaws of humans. I have no idea why anyone would sign up for this. All they're getting is half a chocolate bar out of it. They must have paid them well. So they put it in their jaw 3 different times, and that elicited a pain response for up to 5 minutes. And then they put a pressure, a little instrument on there that they kind of pushed on the pain site, and they asked the subjects to rate their pain as soon as it turned in from pressure to pain. And then they just kind of looked at a chart displaying different parts of the head, and they said, yeah, this is where it hurts, and this is how much. And so this was repeated 3 times with randomized half squares of chocolate given 5 minutes after each injection. All right? That's a tiny amount, half a square of chocolate. So what was found is that all types of chocolate, just half a square, significantly reduced pain, intensity, and duration, but cocoa content wasn't the primary mechanism. Does anyone want to take a guess what the primary mechanism for? Yeah, it's definitely sugar. And that's because they found that the white and the milk chocolate had slightly more significant impact for pain relief, but still all types of chocolate. So yeah, chocolate. That's a lot of evidence for chocolate. This is just the first. The next study, This is not far off what I talk to athletes about when they want to replace muscle glycogen. Raise your hand if you've heard of like chocolate milk as being like the original glycogen replacer. This is still holding true to this day, but it has to be low fat or fat free so it can get absorbed into muscle quickly. So this drink, I was like, oh, what's unique about this? This was a non-Dutched cocoa. So this is non-alkalized and it's the type that preserved all of the flavonoid content. So this isn't just your standard like Nestle Quick chocolate milk. This is like a special prototype drink that had a lot of flavanols. And they wanted to find out the effectiveness on muscle damage and all those labs that we talked about earlier on perceived soreness after running. So people ran down a hill at 75% of heart rate max. That's very fast. And they did this for 30 minutes. If you're over 40 and you run straight down a hill for half an hour, it's like enough to kill you. I was just like thinking of how it feels to go downstairs for too long walking. So anyhow, they did that. And then they looked at the evidence of muscle damage. And of course, like creatine kinase and all these other labs were elevated, right? So each subject served as their own control because in each of these trials, there were 3 drink conditions. It was water, or it was this chocolate drink before the run and after the run. So they had 3 tests. And then they just asked some different DOMS questions about like squatting, sitting, walking around a corner on even ground, et cetera. So this was a mix of 40 grams of carb and 10 grams of protein. That's pretty spot on for muscle glycogen replacement. A 3-to-1 or a 4-to-1 ratio is perfect. And again, the only thing that was different here is they used that natural, non-alkalized cocoa, okay? So when they had that chocolate drink 2 hours after the run, they experienced significantly less DOMS across a 24-hour to 48-hour period. So excellent. And then one brand of this that I wanted to show you that you can find this is actually the only one I found on the web that's readily accessible, is I think you pronounce it Zocolado. It's with an X. And it's from Peru. They just sun dry it and then they press it into a powder and it's unsweetened, but it's identical to the one that they used in this study. So it has the same ratio, 3-to-1, complex carb to protein. It's unsweetened. And the way that I like to do this is you can mix it in bone broth. Bone broth sounds like you shouldn't do that. It's delicious. It's not a savory, weird thing. You can put a just tiny bit, like half teaspoon sugar in a full cup, and you would get 10 grams of collagen protein, which is very bioavailable as a source. It's much better than a powder. And you can have 1 or 2 tablespoons of this good quality, unsweetened, non-Dutch cocoa. So this would be a great recovery drink because of that high protein that it's got. All right. Let's move along to the next topic. Oh, no, just kidding. There's one more study. Okay, this one was in rats. You guys, it was really hard to find studies on pain. It's hard because I think very rarely will an IRB be like, what are you going to do to people? No, like, let's try again. So to have a clinical measurement of pain that's relevant, it has to be like a validated tool. So that's why a lot of these studies are done in rodents and not humans. And to find clinical trials on all the things I present on today is really hard. There's not a lot of studies. So keep that in mind that when I show you these RCTs, like there's not that many out there on humans. So the ones that I'm showing you, I think they're great. So anyway, this one is on rodents. So what they did is they just basically increased the cocoa content up to 10% in a rat's diet. And they compared it to a standard chow. And similar to what they did in that one study, they in the jaw muscle, they put capsaicin cream, which is the same stuff that like a hot pepper. It's from that, and it induced pain all over their jaw. And then they went and they counted, I was just imagining this research, they counted the licking events of sweetened condensed milk after placing these rats into a hot or a cold chamber. So basically the concept here is that cocoa increases the pain tolerance for heat and for cold exposure. And that's the only way they could test it in animals. So they saw the licking events and they had the math run. And the stats showed that there was a significant difference in the cocoa-fed rats where it inhibited not only their temperature sensitivity, but it significantly increased their pain tolerance. So yeah, again, cocoa over the long term, right? Not just one dose of hot chocolate, but having good quality cocoa a few times a week is probably something that we could do. All right, moving into the next food, this is different kinds of fruits. So fruits mainly help with recovery because they contain polyphenols called anthocyanins. And I have it abbreviated as ANC throughout. And these are polyphenols that give them all their pigmentation. So the red, blue, the purples. This is from anthocyanin content. And they do two cool things. They're hydrogen donors, number one, so they help to neutralize free radicals and stabilize them so they stop causing cellular damage. And then secondly, they inhibit all of that extra nitric oxide production, which again, I said is normal from exercise, but it's really when it's persisting that it becomes problematic, okay? So just so you know how much anthocyanins we get, because these numbers don't mean anything unless you know what's common for what we're eating in the diet. A survey of 10 Western European countries reported that people are consuming an average of 25 to 90 milligrams of anthocyanins a day. And this is in Western Europe, so not far off from maybe us. And as soon as those levels go over 22 milligrams a day, then there's all of these correlations with reducing risk of heart attack and diabetes and other inflammatory diseases. So if you look at this graph, it shows you the different content. And of course, the check mark is at the top. This is from high to low. It was a little tricky to show this because the serving sizes change for the anthocyanin content. But in general, wild blueberries, which is not the study I'll show you next, it's just done on blueberries. But wild blueberries have well above and beyond the antioxidant capacity of regular. So I've only seen them at the grocery store as frozen, and I think the brand is called Wyman's. So you can look for those, and they're really good in yogurt, but wild blueberries are the best. And then, of course, there's pomegranate, eggplant, berries, and the unsung hero, black beans. Everyone forgets about beans. So anthocyanins are very well absorbed, and they reach peak at 2 hours after we eat them. So that's important to remember if we want to actually use these therapeutically. It takes 2 hours. So you want to try to time it if you're using it to reduce DOMS, and remember to have a snack with them in it about 2 hours before you go do the thing, okay? And then they disappear 6 hours after. So they're very transient. They get well absorbed in the GI, and then they're gone within 6 hours. Okay, so let's take a look at a meta-analysis. So this looked at a total of 25 randomized control trials on fruits. And these ranged all over the place, from plum juice to elderberry. And then there was even this really random Brazilian drink that was like made of 6 different, I was like, I'm not sure how I feel about this, but it was like orange, apple, cherry, carrot, mango, ginger. They had all, it's like, how do you know it's responsible at that point? So they looked at all of these very rigorous randomized control trials, and they wanted to find out how the impact was for exercise-induced muscle damage. So the overall finding is that the anthocyanins that were in these and were supplemented, berries had the greatest impact, okay, for all 25 studies. And anthocyanins in all the fruits that they looked at reduced DOMS 24 hours post-exercise, and the effects were greater after eccentric movements. So my one criticism is that only 3 of these actually looked at functional outcomes, meaning not just labs, because labs don't mean anything if it's not like felt by the person, right? They don't feel a difference. So in those 3 studies, those are the ones that we'll look at now. And the first one is on tart cherry juice. I'm sure you guys have heard of this. This had a moment in the 80s, and then no one started, using it anymore. But tart cherry juice, in a double-blind RCT, they took some semi-professional soccer players, and they drank 2 ounces of tart cherry juice or placebo for 4 days and 2 days during testing, so a total of 7 days. And this was actually called Cherry Active. You can find this on Amazon. I went and I looked up the nutrition facts, and you can still buy it there. It's made in the UK. So they did a pre and post assessment where they had people just do like the air squat and assess their DOMS before and after. And then they underwent a battery of tests. So 3 times in a row, the soccer players did 12 20-meter sprints, agility tests, jump height, and a maximal contraction of the knee. And they did this each time with the different conditions. So they were serving as their own controls, okay? And The result is that all of these performances were significantly enhanced at every single time point from 0 to 72 hours. And when they looked at the biomarkers, interleukin-6 was significantly lower. So I will say of all of the fruits that these looked at, the ones that had the most evidence are tart cherry juice. And I had one criticism of that. If you actually consumed 2 ounces of tart cherry juice every day for a week, which is what they had to do, it's the same thing as having 9 sugar cubes a day, which, like, you know, what's that doing to the body versus the benefit that it might be providing? So it's the same amount of sugar in a slice of chocolate cake. And I don't know about you guys, but I would much rather have a slice of chocolate cake instead of cherry juice every day. So, yeah. I don't know how many cherries. Yeah, that's a good question. They only did it with juice in every of these trials. So what's my solve for that? We'll look at blueberries next, but if you were to instead do what also has very good research, blueberries, you would only need half a cup of blueberries to get the same amount of anthocyanins, and then you'd get a comparable 6 net grams of sugar. So a lot less and a lot more fiber. So maybe a better trade-off than cherry juice. All right, blueberries, something that is easy and healthy to be eating. So the bioavailability of anthocyanins in blueberries is actually really low. So you have to eat more of them and for a longer time. And in this case, the people ate 1 1/4 cup for 6 weeks prior to the test. And then they ate a cup right before they ran for 2.5 hours on a treadmill. And when they looked at the food records, and this is important because they had to control for what people are doing for the full 6 weeks beforehand. The food records show that there were no differences in the antioxidant composition and also micronutrients. So the result of this is similar. It showed that blood samples and all the muscle biopsies, there was significant reduction of DOMS and exercise-induced muscle damage. And so this is a cool thing. This is really implicated in cancer. They're called NK cells, and they're killer cells. They doubled in the 6-week blueberry consumption. The cell count had doubled, and they'd never seen that happen before. In the group that only ate the acute dose, there was no change in that. So I don't know if there's implications for cancer with blueberries, but that's pretty interesting. Okay, moving along to the next thing. It's not really a food per se, but it's a functional food. It's a root, and it's called turmeric or curcumin. And I'm only highlighting one study of curcumin because overall, there are so many human clinical trials done on turmeric. I will say, aside from fish oil, it is the most profoundly evidenced supplement for controlling inflammation. So I say that really strongly. I actually added it to the list of supplements that all of my patients who are coming out of a surgery, I think they should be taking because it's so effective. So in this RCT, people took 40 milligrams of curcumin, the bioactive compound, for 2 days before a run and for a day after. In this case, it was a 4-day total course. And this is actually called Mariva. So some of you may know, when you're going to buy a supplement, it matters if it's a pharmaceutical grade brand. And in this case, it matters. So if you get curcumin and you're taking it, which I do recommend it, it's so great, look for the word Mariva. Okay, that's a trademarked bioavailability kind of product. And I'll show you 2 products that have it. But Mariva has so many trials showing that it's been efficacious for things like osteoarthritis and other inflammatory conditions. And it was compared to aspirin and showed to be validated as effective as acetaminophen. So that's pretty good. So after they took turmeric, they ran downhill for 45 minutes, all this downhill running. And they had an MRI and a biopsy. And then they said, how much pain are you in when you're using stairs after this? So curcumin did the same thing, significantly reduced muscle injury in the MRI and showed that there was less pain associated with DOMS than placebo. So curcumin is fantastic, and I want to say as a side note, after I read all these studies, I started mainlining curcumin. As I mentioned, I have that injury, so I'm in a return to run program. And I kept finding that the compensating leg was hurting 2 days after adding more mileage, and I'm not doing a lot of mileage right now. It's really small. But even adding 2 more minutes, each week, I would find 2 days later I'm in pain. And I started taking curcumin, and it's completely eliminated that. And again, this is anecdotal, but I really think it's great. And it's not expensive. So, yeah, curcumin. Here are 2 brands that are made with Mariva. The first one is by Pure Encapsulations. Again, you don't want to buy these on Amazon. You want to get them from the manufacturer. And the other one is made by Thorne, okay? There are probably more, but those are 2 that I know the brands are good. Okay, we're moving on to our last functional food. And it's fish oil, but it's omega-3 fatty acids. It's the same thing. So just remember, it comes from fatty fish. And if you're not sure what fatty fish are, they're going to be trout, tuna, salmon, black cod, and then tinned fish. Everyone forgets about tinned fish. But anchovies and sardines are outstanding. They're a lot of the times more sustainable, and they're cheaper than like buying a pound of salmon, right? So yeah, those are the fattiest fish that are made into these types of fish oils. So most importantly, when you think about what fish oil does, is it's an inflammatory mediator. So it basically stimulates all of these types of eicosanoids, and eicosanoids are hormone-like chemicals that have all these profound physiological impacts in the body. So an example of fish oil is that they either turn on inflammation or turn off inflammation, and examples would be like vasodilation. So it opens up all the vessels, and that can lower blood pressure. So if you have some patients who are on blood pressure medication, think of fish oil for them because there's really good evidence. Another thing that it does is lower triglycerides. So people with very, very high fasting triglycerides, fish oil is outstanding. So it's good for cardiovascular and heart health. It's good for brain health. It goes all the way up to doses of like 20 or higher for different cognitive impairment, dementia, things like this. So like it has so many purposes, but more recently, high doses of fish oil have been found to be very effective for preventing muscle loss after injury and surgery. No one knows this about fish oil. It's the talk I gave last year here, but it's anti-catabolic. It prevents loss of functional strength. It's not just an anti-inflammatory. It preserves muscle mass, and that is huge. Not many things aside from protein can do that. So as I mentioned, so many benefits, but obviously today we're talking about pain after exercise. So what does it do for that? We're going to look at a couple RCTs for omega-3s. So in this first study, people took 3 grams a day, and just so you know, the minimum dose to preserve strength is 3.4 grams a day. And that's what's been shown over and over again, even in young women, even in people who go through a tiny period of immobilization, like they're in a cast or something like this. 3.4 grams a day is enough to prevent atrophy, okay, and preserve functional strength. But if you want that anti-inflammatory effect, it's much higher. It's 5 grams a day. This makes it prohibitively expensive. Fish oil costs a lot. It's like $65 a bottle. So again, it's like you have to be thoughtful around talking to patients, right? Because it's just such an expensive supplement. But those are the doses that are therapeutic. So these people didn't take even a high dose. They're taking 3 grams a day. And they took either that or a placebo for a month, and then they ran downhill for an hour. And this is obviously on a treadmill. It's a long time. So what was found in the fish oil-treated people is that DOMS and interleukin-6, that cytokine, were significantly reduced compared to placebo. And also their peak power in the placebo group was terrible. Like they had no power when they tested them 2 days later. But the fish oil group had the same amount of power in running as before they ran downhill for an hour. So that's pretty impressive. And then in this other study by Juris et al., people did eccentric bicep curls. Okay, so they slowed down the eccentric, and they did them on one of 2 occasions. They either did it before they restricted dietary omega-3s for a month or after 1 week of supplementation. And again, the same thing was found. The magnitude of DOMS and soreness was significantly lower in the omega group. So many different kinds of exercise, not just running downhill. This also has applications for weight training. Okay. A little caveat. So think about like who this applies to. This is not just athletes. These are people like a perimenopausal woman who has been told she has low bone density and low estrogen, started HRT, and is like, I've never lifted a weight in my life, and been told, like, you need to start heavy weight training. Do you know what it feels like for the first 3 months when you start something new like that? You're in so much debilitating pain. Raise your hand if you've ever had DOMS. Okay, has everyone in this room hopefully experiences? Yeah, it's a universal thing, okay? And it's no fun because sitting down in a chair for 2 days is not fun. Like walking downstairs sucks. Like all this stuff, it really, it inhibits daily activities of living, right? So it's not something you want to live with, but when you tell a patient who's going through a physical therapy program and they're just starting it, they don't want to be in pain all the time. They're already in pain from the injury. So it's really this like one step forward, 2 steps back kind of thing that people have to deal with when they're starting something brand new, a new training program or PT. And in order to help them comply better, you can give them these guidelines around fish oil or whatever else, and it will help relieve their pain. So they're more likely to comply to the program you're giving them. And then that makes you look better as a clinician because they're like, yeah, this is working for me because I'm able to adhere to it. So remember, pain is a big barrier for people to stick with what you're prescribing to them. So that's why I think these things have like incredible application because they're not drugs. Anyway, that was a tangent. But okay, so finally, one last paper on fish oil. So this is a meta-analysis of 23 RCTs. And what was found is that omega-3 fatty acid supplementation for more than a month significantly lowered interleukin-6, that really important mediator, in all 23 studies. So the evidence of muscle damage was just reduced in every single study. So fish oil, I think, has the most application. If I had to rank these from the studies that I've been reading for the last half a year, the second one would be curcumin. And then of all the fruits, I think berries are the best. And then finally, and I don't know what time it is, 12:13. Okay, I have some time. I want to take questions too, but I do want to quickly touch on one thing. By the way, if you want to tell your patients what are 2 great brands of fish oil, these are them. They're pharma grade. Fish oil is tricky because it has to be bioavailable, free of mercury, heavy metals, like sourced from the right fish. It goes on and on and on, the list. So these are 2 great brands that I tell my patients to get, also from the manufacturer and not from Amazon. But you can see here that you need like a really high dose to get to that 4 grams or the 3.4 grams, depending upon what your goal is. Okay, so in closing, I just want to wrap with what to avoid. Omega-6 fatty acids. Are you guys familiar with vegetable oils and you've heard all the things that they're like allegedly responsible for? Well, they're all true. All of them are true. They're very pro-inflammatory, and these are coming from things like soybean, cottonseed, canola oil, which I have to let you know are hands down used very widely in the restaurant industry. So if you're thinking to yourself like, yeah, I don't eat packaged or processed foods, and I don't eat those mixed nuts from Trader Joe's, and I don't eat salad dressings out, which have all omega-3s or omega-6s in them, then the place you will find them is any single meal that you order out. Even high-end restaurants, 90% of them, there was this like New York Times expose where they were highlighting this, that none of them use olive oil. They all use canola oil because it's cheap and it's subsidized. So what's so wrong with omega-6? Omega-6 turn on inflammation. So I told you that fatty fish turn it off. They open the blood vessels. They drop blood pressure. They release inflammation like PMS and depression. All these things that are caused by inflammation, fish oil is shown to impact those positively. Vegetable and seed oils do the opposite. They increase blood pressure. They cause blood clotting. They do the opposite. So they are inflammatory. I'm not going to go into how, but if you have that question, I can tell you how. And so you want to be avoiding these. So think about like your exposure to them. If you're trying to manage pain or if you're talking to patients, and ask them like, how often do you cook at home? That's the first way to decrease your exposure to these. Like making your own food, that's number 1. And number 2 is what oil do you cook in? You know, it's great to cook in high heat, and they even make a high heat olive oil now, but avocado oil is excellent for that. Sometimes using coconut oil, which is very saturated, is okay. But otherwise, butter is okay too for high heat cooking. It has vitamin K too, which is great. So those are the oils that are the healthy oils. And I think I have a comparator chart just to show you. These are commonly consumed commercial cooking oils, and the amount of that inflammatory linoleic acid that they have in them, which is really the trigger for inflammation. So anything in red you would want to be avoiding. And you can look for these on the back of a food label, like what it's actually made of. And then, of course, when you look at the yellow, then these are very low levels of linoleic acid, which means they're much healthier. And then anything in green is like almost no omega-6. It has very, very little amounts. So anything in red you want to be avoiding. And you would find it in really surprisingly healthy foods. At Whole Foods, they had Italian anchovies, and it was in canola oil. I was like, why would they do it? Why wouldn't it be in olive oil? So yeah, I just want to say how to put this into practice. So again, if you're talking to patients or thinking about this for yourself, there's one easy way that you could do this, and that's just think of timing. So if you know that you're about to go do something that is brand new for you, or you're ramping up a weight training routine and you're going up in weights, or you're dropping the reps so it's more anabolic, things like this, then what you'd want to do is remember, let me have a high antioxidant snack 2 hours before. So that snack can be like an example, Painterland Sisters yogurt. It's my favorite yogurt. It's very high protein, extremely low carb. It's lactose free. It's organic. It's the highest protein yogurt without any lactose that exists, Painterland Sisters. So I recommend half cup of that, which gives you great source of protein, calcium, vitamin D. And then you can mix in wild blueberries or pomegranate seeds, which have all this evidence. And if you want to get crazy, you can stir some cocoa powder in there, and then you get all the things. So yeah, something like that could be one way to just like have it as a snack. You don't have to do all at once, but those are the three kind of heavy hitters for that. So timing matters. And then, as I mentioned earlier, you want to make sure that you're eating them all the time. You know, choosing a lot of brightly colored fruits and vegetables and putting that in your diet and making that a choice all the time, not just sometimes. And then the last thing is, this is how you can refer to me. So I'm at Mission Bay 2 days a week. I'm there on Wednesdays and Fridays now, and I see patients in person and by video visit 4 days a week. So if you're at UCSF, it's easy. Obviously, it's through Epic. But otherwise, they do need a referral from their primary care if you are not their primary care. You can refer to me, and that will trigger the process, but they still need one from their doctor. Once they have that, this is like the important part, 99% of all nutrition sessions are covered by insurance. 99. So like they're almost never being billed, my patients. So that's great. They can see me up to 3 times and their insurer covers it. So yeah, that's it. Thank you guys so much for your attention today. And I don't know how much time we have for questions, but
10 minutes.
Yeah, great. There's one here, yeah.
We got your place.
Thank you for your excellent talk.
Yeah, thank you.
I have 2 questions about supplements that you hear a lot of people talking about these days, and I'd like to get your opinion. One is type 2 collagen, and the other is creatine monohydrate.
Yeah. I'll start with creatine because I know the most about that. Creatine is one of the most effective and therapeutic and long-studied and safest supplements that we know about in the United States. It's safe for 16 and up to take, and the dose is 5 grams within 1 hour of training. On either side, it doesn't matter. They're both effective, and it's tasteless. So 5 grams is what you do to maintain phosphocreatine in the muscle. But if you want to do a loading dose, you can get there quicker by doing 20 grams for a week, but it does bring a lot of water retention on in that first week. Sometimes even longer, because it's a hydrophilic substance. It brings a ton of water into muscle. So just something to be aware of. And then collagen. Collagen has a lot of great evidence for hair, skin, and nails, but not like really poor amount of evidence for supporting musculoskeletal and joint health. So I actually talked to 2 of the surgeons that I work with in the Women's Sports Medicine Center, and they're like, yeah, the evidence is poor for joint health, contrary to what people think. Yeah. So a lot of aesthetic benefits, but yeah, maybe not for that.
Yeah.
Yeah, so creatine is 20 grams a day for loading and 5 grams a day for maintenance. Yeah.
So I mentioned before that I'm in charge of a group of about 16 guys and ladies who play tennis at a really high level, much higher than mine, than I can do. And the only way I can keep up with them is if I eat like vegetarian for the whole entire day or the night before.
Yeah.
And we play at night, and it makes a difference. I could, and pain improves also. So do you know anything about just vegetarian diet versus
Like just being
exercise?
anti-inflammatory. A vegetarian diet can be very healthful if carefully planned and very unhealthful. And I've seen both ends of the spectrum in my practice. So when vegetarian or vegans especially, when they completely eliminate tofu, I have to ask them, where are you getting your protein? Like literally, quite literally, where is it coming from? Because all vegetarian sources of protein are inherently starches first. So think about beans. Beans are mostly starchy with some protein, right? But they have some. Nuts are mostly a fat, but they have some protein, but they're not high protein. And the second part of that is that plant proteins are not as bioavailable as animal proteins are. So you have to eat more of them for the amino acids to have the same effect on muscle protein synthesis. So those are two caveats with it. But as you just mentioned, if you're eating a well-planned vegetarian diet, you're getting tons of antioxidants from plants. All of the chemicals we learned about today, polyphenols, flavonoids, these are present in high amounts in colorful plants. So yeah, they do a lot for inflammation. And when you get older, you start to notice these things like, oh, my knees hurt or this hurts. Like, that's inflammation, And you don't need someone to measure it. You just know. You know how it feels in your joints. So yeah, I think that you're probably doing it right. Are you eating tofu?
I'm only doing it intermittently.
Okay.
Like 3 days a week, and that's what I do.
Yeah, that works. You could do it like that too. Yeah, but thank you for sharing that. Yeah.
I have a question about omega-3 supplements. I find the main limiting factor of this for patients is tolerability because they really don't like how it tastes with the high doses. Do you have any
Yeah, so I
comments?
definitely never recommend cod liver oil because it's disgusting. And all of us were traumatized if you're over 40, like your parents tried giving you that as kids, and you're like, never again. But the soft gels, they're really well tolerated. The only side effect that people kind of get is GERD, gastroesophageal reflux. And you can kind of counter that by having them at dinner with a fat source in the meal, and then they're well absorbed. And then if you get like fish burps, you just go to bed, so no one cares. Your partner will care, but yeah. And then eating them with a meal will help. Yeah. Okay.
Thank you. Are there any foods that are cortisol decreasers? Something like the cortisol manager or ashwagandha would be a supplement. But if you're trying to do food as medicine, do you have any suggestions
That's a great
for
question. So
cortisol?
the first, ashwagandha is key. So for those of you that don't know what that is, it's really cheap. It's a root. It's an adaptogen, which means it lowers the stress response, and it's been shown to lower cortisol. I had some today because I was nervous for this talk. It tastes like dirt, a little bit like dirt. It's kind of like clean dirt. You just put like half a tablespoon. You could dose it in water, and you just shoot it back. It works. It works also if you're like over caffeinated. It takes the edge off of that. So yeah, that's one adaptogen that's fantastic. Others are like lion's mane and reishi mushroom have a lot of promise, but unfortunately not a lot of clinical trials because they're not considered like westernized medicine. And then the last one that's a food is protein. So I talk about this with women in perimenopause and menopause because their baseline cortisol levels are higher just upon waking. So some of you guys may know cortisol is an arousal hormone. It wakes us up in the morning. So it's naturally at its highest point, and then it drops all day, and it's at its lowest point at like 10 at night. So if you're in perimenopause or beyond, you wake up and that whole line is right shifted. It stays higher longer, and it's higher at baseline. So waking up in the morning and having a 15-gram dose of protein in research will blunt the cortisol spike from remaining high. It'll spike it for a second, and like all food does, and then it drops it. people who skip breakfast, especially women in their late 40s, that line that I was just talking about of cortisol, it shifts it all the way to the right if you skip breakfast, so it stays high all through the mid-morning. And a major function of cortisol is to break down muscle. So why would you want that happening all day? So that's why fasting is a terrible practice for perimenopause and women who are in their late 40s and beyond, because it's like basically conspiring to break down muscle mass, which is already happening because we're losing estrogen and a million other things, right? So yeah, protein is in small doses, 15 grams effective for that. But that morning cortisol is really the one that is important.
Thank you so much for your talk. It's been really helpful. The most widely brought in supplement that I see is glucosamine.
Yeah.
So what are your thoughts on what dosages are helpful?
I honestly don't know almost anything about glucosamine. Yeah, I just don't know anything about it. Yeah, I've heard it's great for joints, but I don't know.
It's great in dogs. I heard it's good for dogs.
Is it? Okay,
Yeah.
there you go. Yeah.
It's about it.
Ask your doggy.
Hi. As far as protein goes, like, what are your takes on like whole foods proteins versus protein powder,
Yeah.
like differences, all that
Yeah.
stuff? What's important in that sense for maybe different age ranges of athletes to
Yeah.
older women, stuff like that?
Excellent question. So with protein, I'm sure you guys know there's all this. There's so much attention on protein right now. It's like ridiculous. So there's not a one-size-fits-all dose. It completely depends upon how active you are, how big of a person you are, and how old you are. But the most important thing is after age 35, we start to have anabolic resistance, all of us. And what that means is our body can do less with the same stimulus of protein at a meal or neuromuscular stimulus like heavy weight training. Our body can do less. It can not build muscle as well with less. So if you're in that class of over 35, and as I mentioned earlier, if you're a woman in your late 40s, then your needs are even higher. If you're someone who's active and you're a vegan, your needs are even higher because of those anti-nutritional absorption factors from plants. So there's like a lot of gray area, but I will say this, like a lot of people are using protein bars and protein like powders. And I look at food pictures 8 hours a day. That's literally what I do. I have everyone just do food journals and photos now because it's low tech. And they appreciate that because no one wants to log like in MyFitnessPal. It's like the worst. So I look at food photos all day. And when I see like powder bar, I'm like, where's your real food? What is your body doing with this, right? So yeah, I definitely always push a food, like a real food mentality. So you know that your body can recognize it and absorb it. Obviously there's utility for supplements, but the very top there is whey protein isolate. And then, or excuse me, that's actually not true. Egg white protein is the top, but it doesn't mix into anything. So there's that. And then second is whey protein isolate. The brand that I like is called Transparent Labs Unflavored. And then the next most bioavailable is soy protein isolate, and at the bottom is pea protein. So one brand that does pea protein is Vega and Orgain. And they also have vegetable oil in them. So if you're using those products every day, you're getting omega-6 fats every day on top of like a really poor source of protein, which is pea protein. So obviously if you're a vegan, you can't have the whey. You know, you could do other things, but getting tofu in your diet is like the best way to get all those amino acids. Yeah. And the last quick thing is raise your hand if you've heard of Yuba noodles. Only a few of us. Okay, Yuba noodles are delicious, and they're made from tofu. So they come in a brick, and the brand that's here in the Bay Area made in Berkeley is called Hodo, and they're like nutty and creamy, and you can like slice them up and pull it apart, and it looks like egg noodle, and that is, for vegans and non-vegans alike, a delicious way to have a high-protein meal. Literally, open a package, put it in a pan, like done. So I highly recommend that to people who are like, I don't know how to use tofu. I'm like, get some Yuba noodles and you'll see. And they're delicious. 40 grams of protein in a pack and really easy to season too. So sorry, that was kind of a like glaze over of a protein answer, but hopefully I gave a little bit of each topic. I think there's one more in the back.
Yeah, we got one more. We're not going to take one from you. No way.
Hi, Dr. Chang.
I would just say, great talk. If you are dealing with elite athletes, drug testing is involved. I'm glad you mentioned Thorne, but you have to make sure that they have an NSF certified label on them. And even that doesn't guarantee, but NSF certified, definitely check on that, especially if they are athletes that, for purity,
Yeah,
right?
yeah.
Because we've all heard of these cases of things tainted with steroids, anabolic steroids, et cetera. So we had a question in the back corner from Dr.
Yeah, you and Nick.
Hadamiya,
Yeah, what's up,
who
guys?
doesn't want to speak. Wild blueberries versus blueberries that you can buy. What's the difference? You keep saying wild blueberries, wild
Yeah.
blueberries. Can you tell us if
Yeah.
there's a difference between that and Whole Foods blueberries?
Oh yeah, so the anthocyanin content is like 18-fold. I just made up that number. I just know it's really, really absurdly high in wild blueberries. So I've only seen them, obviously, like growing on the side of the road in Oakland when I ride my bike. I was like, there's some wild blueberries, but you can't get those. So what you can do is just get the wild frozen ones. They're called Wyman's. That's the brand I've seen at every grocery store, including like Whole Foods. Yeah, and they're just higher in antioxidant value, so they're better. If you're trying to reduce pain after exercise, I recommend wild blueberries. Otherwise, definitely enjoy blueberries. We looked at the study today, and we saw they reduce evidence of muscle damage, right? So regular blueberries are great too, but you have to eat them for 6 weeks. You have to eat a cup and a half for 6 weeks. Wyman's with a W, W-Y-M-A-N-S. Yeah. Yeah, blueberries are great.
All right. Well, we
Okay,
are out
thank
of
you,
time.
guys.
Thank you, Lindsay. Appreciate it. Great talk. All right, guys, it's lunchtime. Don't forget, 1:30 back in here for a couple announcements and the raffle. So you can get your registration for free next year if you come to here, maybe. Have a good lunch, and thanks for your participation.